So the first aspect of the SOPs in the aftermath of COVID-19,
Can
I'm
you
going to
can
be.
you can
Can
you
you hear
please
me?
take it on slideshow?
Yeah, that's fine.
Yeah,
Yeah.
perfect.
Yeah. So the first aspect which I'm going to deal with is the triage and the appointments in the aftermath of COVID-19. Now, the appointment triage. So far, we have dealt with only triage when the patient comes, and we take a history and see the findings. But I think now we'll have to get used to the concept of appointment triage. That means even triaging the patient even before you've seen the patient. That is, while giving the appointment itself, you vet all the aspects of that particular patient. And for that, this is a very simple grading system. This is something which we have started at Hinduja Hospital. Dr. Nayak sir will be aware about this also. Now, this has simply three questions which can be asked even by your secretary or the person who's giving the appointments to the patient. There is a travel within the last 14 days. And then, depending on the answer, you grade it as 2, 4. If it's domestic travel, international travel is 8 points. The second question will be symptoms in the last 14 days. So this is pretty straightforward. No symptoms is 0. And if the patient has upper respiratory tract symptoms and cough, fever, it's 10. And the last is the contact of the patient with, a COVID positive patient in the vicinity. So here we have again 0, 6, and 8. And then you calculate the scores and you come up with the total score. And essentially, you look at a score less than 6 and more than 6. So less than 6, it will classify as low risk, and more than 6, it will classify as high risk. And then you have the signature of the person who has taken this questions from the patient, writes the name over there. And then if it's less than 6, the management is as a general patient, of course, but with all standard universal precautions. But if it's more than 6, then your red alarm goes up, and then the patient goes in through the entire protocol for COVID. So this particular questionnaire and this criteria are essentially given come up by the American College of Surgeons and the Royal College of Surgeons. So this is about triaging on phone for the patient. This will have to be looked at in the near future. When it comes to scheduling appointments, someone already mentioned that we will have to stagger our appointments. A lot of us are used to seeing 15, 20 patients in 1 hour, probably, those with high volume patients. But we might have to come down to seeing maybe 4 patients in an hour. So probably give slots at 15-minute intervals. We will have to avoid scheduling in the distant future, because remember one thing, when you take this questionnaire, when your secretary takes this questionnaire, it will have to be immediately before the appointment. If you're going to give an appointment couple of days future, the situation might change. So if you're giving the appointment in the distant future, you might have to triage the patient once again on the phone and make sure that his score is under 6. So that is important. Now we are used to OPD list. Now what I mean by this is we are used to the concept of operation theater list or OT list, where we are involved with our OT list. We very rarely we give less importance to what our OPD appointments are, really speaking. But now we'll have to get used to the concept of OPD list, where as clinicians we are taking active interest in seeing whether the OPD patients and the appointments are triaged or not. We might have to even get used to the concept of calling geriatric and pediatric patients at separate timings. Probably the big institutions already have separate areas to deal with these patients. They can do that. But when it comes to small setups, they may have to be called at separate timings, because we know the geriatric group is more susceptible to COVID. And lastly, someone did mention that our OPD hours are going to be long, because we are going to see less amount of patients in the same amount of time. So we will have to get used to working long hours, and probably our staff we will have to divide maybe in 1, 2, or 3 shifts, so that the staff energy and the ergonomics are also suited to those kind of long OPD hours. Regarding prepping the patient, this is my last slide, actually, second last slide. Now we just like we prep the patient for OT. Here probably on the phone our secretaries might have to prep the patient before the appointments. So the patient will have to be told about the longer waiting time. Patients sometimes are used to a certain amount of time in our clinics. Now those patients will have to be told that there will be a longer waiting time. They will have to be told to take all the precautions like wearing the masks, the patient with the attendant. Otherwise, your resources are going to get depleted if you start providing masks to everyone who's going to enter your clinic, mind you. They have to be told that they may have to give special consent. It's better to tell them on the phone that we will be taking a special consent, probably asking them to write a questionnaire. About attendance, if it's usual routine refraction patients or young patients, probably you might have to tell them don't come with an attendant, and at the most allow one attendant for aged patients and pediatric patients. And one more thing is, if the child is not a patient, is just an attendant, then avoid calling the children. You have to tell them that no children will be allowed as attendants. So these are some of our appointment protocols we'll have to change. And lastly, just a touch up on these 2 points. Someone about telemedicine and teleconsultations. So how do we give appointments for telemedicine and teleconsultation is again a matter of debate we'll have to look into. And in the recent past, we have seen that artificial intelligence has played a big role in diagnostics and in investigative modalities. So probably it is time that we start using AI for scheduling our online appointments. Because at the end of the day, how much can your operator who's or your secretary who's taking appointments, how much time can she spend really on giving appointments? So probably you might have to use artificial intelligence. So these were some of the aspects of appointment scheduling which I thought I would like to share. Thank you.
Thank you very much.